All right, let's talk about ankle sprains, ligament injuries, but really what I want to focus on this video is more so the secondary issues that can come along with it. So most common area that you're going to see an ankle sprain ligament-wise is going to be on this outer side. There is 4 ligaments. This one is actually 2 branches and it's kind of attached to the same place. It's referred to as the same ligament but different branch. And then there are 2 big ones on the inside of the ankle that also can get injured. Even with a lateral ankle sprain, the inside can get irritated, gets pinched, things like that. Your mechanics change, gait changes. But what I want to talk about is some kind of residual pain or maybe just referred pain that can be of nerve irritation that can go up the chain. So I'm going to throw on some nerves here. Now, ones that I definitely want to cover, and let's actually go to the side and zoom in a little bit. This nerve that is coming down the side and wrapping around kind of by the heel, what it innervates is it gives sensation to the bottom part of the leg on the outside, but particularly like the outside of the foot here. It also can give some interesting sensation a little bit up into the low leg. Let's look at where it really comes from though. So any nerve is going to always stem from the spine, okay? So it's something to always keep in mind. So when I am assessing any joint whatsoever, I'm always going to assess a nerve in the area, and then I'm always going to go back to the source, right? So think of nerves like computer cords, things like that. It's sending a signal, and it has to tell your spinal cord what that signal is so it can travel up to your brain so you can interpret it, right? So with the sural nerve, it's coming out of the low back, comes down, turns into the sciatic nerve, comes down, takes a little split. Part of it branches off, and if we look at it from behind actually, part of it branches off and goes on this outer side of the leg. Part of it branches off and comes to the inner side. This one is a branch off of a branch. It's called your sural nerve though. So why I wanted to look at that, let me get back to the main one, is because sensation-wise, it does sensation to this outer 5th toe, okay? And it also, if you can see, it can have some nearby pain sensations in the area. Now, a lot of times when people have ankle sprains, they'll end up telling me, oh, I've just got this weird, annoying tension coming up the back of my leg. So to me, that doesn't sound abnormal. To them, it sounds very abnormal. So the other nerve I definitely want to take a look at is called your tibial nerve. It's also a branch off of that sciatic nerve. Runs down the back side, and I am going to throw some muscles on here so we can just kind of see relatively where these are for you guys. So we're familiar with the big gastroc, big calf muscle, right? Part of that sural nerve that we were just looking at goes right here between the gastroc heads. Let's see if I can click it. So that's part of your sural nerve. Okay, so what it does is it does the skin and the lateral surfaces of the leg and ankle. So it does kind of out here and then heads back down, like I said, to that ankle joint. Okay, now this other branch of nerve that I want to show us is also part of the sural nerve. This is the lateral branch. This is the medial branch. So what it does is it does skin, the skin sensation on the outside of the leg, right? So this other one comes down and it does outside of the ankle and side of the toe. This branch up here, this side of the leg. Other big one to take note of, this is called your saphenous nerve. It does sensation on the inside of the leg. So whenever there is irritation on one side of an ankle, remember if it's a joint and your mechanics change, you're going to have effects on the other side also. So this one travels all the way up. And again, they all stem from the low back. So these are all things, and let's actually take muscle off and look at the tibial one more time. It is underneath the calf muscle. So a lot of times people will be like, I'm digging around with a lacrosse ball, I'm stretching my calf and I'm not getting any relief. And really it's because you can't actually get to this nerve. So the most effective way for me is either dry needling or looking at nerve glides where I'm really just having them do a series of motions that help glide this nerve through its pathway. One big thing I want to remind everyone of, we just saw that big pathway of nerve, but I want to show you as far as muscle goes. This comes up, it goes underneath the hamstring. If I were to take these hamstrings off, you can see that's where it goes and it connects, and it's still that big sciatic nerve. Now, interestingly enough, there is a lot of correlation with people with ankle issues on that side. They develop some hip issues, hip or knee. And a lot of times they're like, I don't understand what's wrong with my hip. Well, remember what I was just saying, a nerve is a channel. It talks all the way down, talks all the way up. So if there is chronic irritation and inflammation in a nerve, it's going to travel the length of that pathway. And this is where, if you're running, walking, sitting, standing, you really can't not activate some of these muscles. And they're all innervated, the large ones in this area. So your sciatic nerve, it innervates like your piriformis. It goes down, it does all of your hamstring musculature, some of your adductors. And when I say goes through, it does not actually give supply to your piriformis muscle, but your piriformis muscle sits over it. So let me throw on that. Main place where people hear about piriformis muscle and piriformis syndrome or sciatica, it's when they have that big ache right in the deep part of their butt cheek. So what I will always address, and people always think it's a little interesting, with ankle and knee, I always come up to the hip and I always check out and see, what's going on up here. And more often than not, people will say, actually, I've got a little bit of an ache in my butt cheek and it's weird to me. So more often than not, I will needle the entire chain, right? So let's remember one more quick recap. That it comes off of the low back, right? It comes off the spine, all these branches. They form your sciatic nerve. We'll look at it from the back side. And then they end up going down the leg. So hopefully that's helpful. Let's take off a little bit of muscles just so you can see where they're coming off of in the actual spine. You won't be able to see it externally necessarily, but you can see where it's still glowing. And it's coming out from deep within the spine. So with ankles, you always want to be working on strengthening. You always want to be working on balance. You always want to be working on stability as much as possible for all these muscles that actually end up supporting the ankle. But you also got to pay attention to the nerve, because anytime you overstretch a ligament, you overstrain a muscle, anything like that, those signals of pain, those are traveling through nerves. Nerve is the only way that you even know you have pain, is because it's giving the signal. So that tells you need to pay attention to your nerves. So hopefully that gives a little helpful overview. If you're a patient of mine, I am most likely, if I've been treating you for anything ankle, we've included the nervous system.